Today we will learn the posterior compartment of the arm. Okay. This is the anterior aspect of the arm and this is the posterior aspect of the arm. In the posterior aspect of the arm, we will get one important muscle which has got three heads of origin, and it's very obvious, that is triceps, which has three shapes or heads of origin. One we know, one head is called the long head, which takes origin from the, this area is called the infraglenoid tubercle. This is supraglenoid and this is the infraglenoid tubercle. And from here, the head which takes origin, it is called long head, coming from the infraglenoid tubercle. And that long head, the origin is a bit peculiar because we know there is supraglenoid tubercle which is meant for the origin of long head of biceps brachii. Always practice this one, that is biceps brachii, because there is another muscle in the lower limb that is also known as biceps, but that is biceps femoris. So biceps brachii. So supraglenoid is for the long head of the biceps brachii, and infraglenoid tubercle is for long head of the triceps brachii. And this supraglenoid tubercle for biceps brachii, it is within the joint capsule. We know there is a shoulder joint, there is a shoulder joint capsule. So this origin, or this origin means the long head of the biceps, it is definitely within the joint capsule. But the long head of the triceps is beyond the joint capsule. Joint capsule means this, the capsule which called the capsular cartilage which covers this joint. So triceps, the long head of the triceps, the origin is infraglenoid tubercle, but it is extra capsular. Okay. So this is the long head. The next one is lateral head. We can see the red mark. This red mark is for the origin of lateral head of the triceps muscle. And here we can get another red mark which has an extensive area of origin from the posterior surface of the back of the, or the posterior surface of the humerus. Below this groove, there is a groove in between two red marks which moves from medial to lateral, from upwards medially to downwards laterally. We will get a groove. That groove is called spiral groove. Actually, it remains, we can feel that is a spirally, it is oriented. Or it is called the radial groove. Because we know radial nerve is taking origin from the posterior cord, or rather, the radial nerve is said to be the continuation of the posterior cord of the brachial plexus. Gradually, you are having some idea gradually what is brachial plexus. It is formed by the ventral rami of C5, C6, C7, C8 and upper division of the T1. That means thoracic nerve, first thoracic nerve. So ultimately, it's a network of plexus and ultimately it ends in some cords. That is lateral cord, medial cord and posterior cord according to their position to the second part of the axillary artery. We have seen the axillary artery there. Okay. So, that is the posterior cord which remains posterior to the axillary artery, which is, and it is continued as radial nerve. So, during its journey through the spiral groove, the radial nerve actually gives some branches, or which are called the twigs. Twig means branches to the muscles, okay, or any joint, either or any subcutaneous tissue, okay. So any branch is called twig. First, actually when it is traversing the axilla, it is coming from the axilla, then it is entering into the spiral groove. Before that, it is traversing the lower triangular space of the scapular region. First, in the axilla, it gives branches to the medial head. When it remains in axilla, already it sends a branch to the medial head of the triceps. Okay. And also, when it is traversing from axilla to the spiral groove, it also gives a branch to the long head. So already the long head and the medial head, they are getting the twigs or the branches when the nerve is already within the axilla. So within the axilla, radial nerve gives, remember, it gives branch to the long head and to the medial head. Then when it is moving through the spiral groove, it is giving a branch to the lateral head. Lateral head is actually, if we palpate the posterior surface of the humerus, we will get a curved ridge. That curved ridge is for the origin of the lateral head. So here the nerve is coming down, and during its journey through the spiral groove, it first gives branch to the lateral head. And when it is traveling this, or it is passing through this spiral groove, it cannot resist itself of not giving any branch to the medial head. It cannot resist. Again it is giving another branch to the medial head. So, the funny thing is the medial head, which has got extensive origin, is supplied twice by this radial nerve. One branch already when the radial nerve was in the spiral groove. And again, when it is, when that radial nerve was in, it was in the axilla. Again, when it is traveling the spiral groove, again it is giving a branch to the triceps, the medial head of the triceps. And this medial head of the triceps, it comes down. And from there, it is continued. And it goes deep to the medial head and ultimately ends by supplying the another muscle, very small muscle, which is taking origin from the lateral epicondyle and which has got insertion, very short muscle, triangular muscle, that is the anconeus. So that nerve to anconeus is again another branch which is coming from the radial nerve. Actually that nerve to medial, the branch which is supplying the medial head, it is continued and ultimately it supplies the small muscle which has got same action. That means this is flexion and this is extension. Okay. As if it is another head of triceps. It looks like it behaves like triceps, small muscle, and that is in any extensor muscle of the, whether it is in the arm or whether it is the forearm or a greater part of the dorsum of the hand, it is being supplied by the radial nerve, the in different way. Okay. So this nerve that is within the spiral groove supplies the lateral head, it supplies the medial head, and it also that becomes it is continued as the nerve to anconeus. Another nerve we can get from the radial nerve. It will come out, it will pierce the triceps muscle and it will pierce the deep fossa and it will become cutaneous nerve, which supplies the forearm, which is called posterior cutaneous nerve of the forearm. So we can see so many branches. So nerve to anconeus, nerve to medial head, nerve to lateral head, and posterior cutaneous nerve of the forearm. Another branch will come out and it will supply lower lateral part of the posterior compartment of the arm. So that is called lower lateral cutaneous nerve of the arm. So lower lateral cutaneous nerve of arm, posterior cutaneous nerve of forearm, nerve to medial head, nerve to lateral head, nerve to anconeus, these are all branches of radial nerve in the spiral groove. Now we can imagine one muscle which is taking origin from the clavicle, from the scapula, and it is inserted over the deltoid tuberosity. That muscle is called deltoid muscle. And we know that there is another branch from the posterior cord which is called the axillary nerve, which traverses the actually rounds the posterior part of the neck of the humerus, which is the axillary nerve. So this axillary nerve has, one is anterior division, one is posterior division. From the posterior division, one nerve will come out, and from the anterior division, another nerve will come out. From the posterior division, that nerve will come out and it will pierce the deltoid muscle, and it will be continued as a cutaneous muscle. So that is called upper lateral cutaneous nerve of the arm. So upper lateral cutaneous nerve of the arm is coming from the axillary nerve, whereas lower lateral cutaneous nerve of the arm, it is coming from the radial nerve. Okay. And also within the skin, just below the skin, when we will dissect, we will first dissect the skin, we will remove the skin. The below the skin, what we will get? Superficial fascia. We have seen fats, subcutaneous fat and superficial fascia, which is adherent with the skin. So that area is supplied by upper lateral cutaneous nerve of the arm, which is a branch from the axillary nerve, and another is lower lateral cutaneous nerve of the arm, which is coming from the radial nerve. And also there are three nerves are coming out. I want to give an impression from the neck. Three branches, that is the supraclavicular, above the clavicle, supraclavicular nerve, which has got medial, intermediate and lateral branch. That lateral branch will also supply the part of the posterior part aspect of the arm. So in this dissection, what we will see, how we will dissect. First, we will give an horizontal incision in upper part, in between upper 1/4 and lower 3/4, and another horizontal incision at the level of the epicondyles. And we will give a vertical incision, then we can remove the skin. And within the skin, we will get superficial fascia, and these nerves we may get, may not get. During dissection, they are very fine structures. It may out, actually during dissection, we may sacrifice those nerves. No problem. Then we will get the deep fascia. When we will cut the deep fascia in same manner, we will get the triceps muscle. Okay. And we know long head, lateral head, medial head. We will cut the lateral head along the spiral groove, and we will discover the radial nerve. At the same time, there is another artery which is called arteria profunda brachii. Arteria means artery, profunda means deeply seated, brachii means arm. This artery is also moving hand in hand with the radial artery. It is coming from the brachial artery. Brachial artery has so many branches, we know. Okay, one of the important branch is arteria profunda brachii, which is coming, and this originates from the medial aspect of the brachial artery. It spirally, it rounds and it moves hand in hand with the radial nerve, and here, okay, and on the, when it actually after traversing the spiral groove, it divides into two branches. One is called going towards the radius, radial collateral, and one is going back, which is called medial collateral. So arteria profunda brachii is an artery which is originating from the medial aspect of the brachial artery. Then it moves along with the radial nerve. It resides within the radial nerve. It traverses the radial groove and ultimately divides into two branches. One is radial collateral and another is medial collateral. This radial collateral artery along with the radial nerve, here we will get a septum which is lateral intermuscular septum. Similarly, on the medial side, we will get a medial intermuscular septum, like fascia-like structures, membrane-like structures, one on the medial side, one on the lateral side. So, on the lateral side, we are getting the lateral intermuscular septum. So, this radial nerve and the radial collateral branch of the arteria profunda brachii, they will pierce the lateral intermuscular septum and they will appear in the anterior aspect of the arm. Near the lateral epicondyle, we can find this radial nerve. Though the radial nerve is a member of the posterior compartment of the arm, but once it pierces the lateral intermuscular septum, it appears in the anterior aspect of the arm. So, in the anterior aspect of the arm, in the lower part, we can discover, already we have seen, I think, the radial nerve. In the cubital fossa, we actually, though it is not a member of the cubital fossa, within the cubital fossa, we will get three contents. That is a tendon artery nerve. Have you seen tendon artery nerve in the cubital fossa or in the anterior aspect of the arm and forearm? Tendon, triceps tendon, T-A-N, tan. Tendon, artery means brachial artery and median nerve. Most laterally we can find under the coverage of the brachioradialis muscle, that radial nerve. Now that radial nerve will move and in the forearm and it will divide into superficial and deep branch, and the deep branch is again, it will appear in the posterior compartment of the forearm, which is known as posterior interosseous nerve. So here, what we can get, so take home message, three take home message. One is triceps, second one is radial nerve, third one is arteria profunda brachii. Okay, so let us see the slides. So we can find this is the posterior aspect. This is the humerus. This is the posterior part of, this is the posterior compartment. This is the anterior compartment. Here we are getting the medial intermuscular septum. Here we are getting the lateral intermuscular septum, and whole is the deep fossa. So this area is the extensor compartment or the posterior compartment of the arm. So here we will get what I have already told you, that is the triceps brachii and the radial nerve and profunda brachii artery. And another thing, on the medial aspect, we are getting the medial intermuscular septum, and we have discovered one nerve, that is ulnar nerve. We have seen it in the axilla. Also we have seen in the, I think we have must seen that nerve, that is ulnar nerve, in the anterior compartment, and it pierces the medial intermuscular septum and it appears just behind the medial epicondyle, where you can roll the nerve behind the medial epicondyle, and you will get a tingling sensation. এইখানে বাবু medial epicondyle এইখানে নয়, এই যে medial epicondyle, তোমার medial epicondyle পেছনে দেখো, you can feel a tingling sensation. That is the radial nerve. So that is the ulnar nerve. So ulnar nerve, though it is seen in the anterior compartment of the arm, it appears in the posterior compartment. It passes behind the medial epicondyle, and the part on which the ulnar nerve is resting, that is not the epiphysis, that is the diaphysis. Okay, so I forgot to mention about the ulnar nerve. So here we are getting ulnar nerve and ulnar collateral arteries. So this is triceps. This is the long head. We can see this is coming from the infraglenoid tubercle. This is the lateral head, and below the lateral head we can see the medial head. Okay. So long head, lateral head and medial head, they joins and forms a tendon, and this tendon is attached to the upper surface of the olecranon process, which is included in the epiphysis. Okay, scale-like epiphysis. So this is triceps. Next, so we can see the origin. This is the origin from long head, origin for the lateral head, and this is the origin for the medial head, and we can discover in between medial and lateral head, this is the spiral groove. These are all the origin of lateral head, long head, medial head. So I want to omit these things. Insertion, already you know, this is the insertion point. Innervation by the radial nerve. Action, you know, that is the powerful extensor. And this long head also supports the shoulder joint from below. Okay, this long head also supports the shoulder joint from below. The shoulder joint is very weak in the lower part. In the upper part, supraspinatus, there is one arch. Okay, there is one important tendinous arch which connects the acromion process and coracoid process, which is called coracoacromion arch, which supports from anterior subscapularis muscle. From the back, the shoulder joint is supported by supraspinatus, infraspinatus, teres minor, and from the front, the subscapularis. So these four muscles supports, but in the lower part of the shoulder joint there is nothing. Only the long head, actually, it gives some support, which is, and This is for your physiology, basically. The clinical testing of, okay. Hi. Now, we can find the radial nerve. This is a lower triangular space through which we can see this radial nerve is coming down, and it supplies to the lateral head, it supplies the medial head, and it is continued. It divides into superficial division and deep division. Okay, just in front of the lateral part of the elbow. And it is continued as posterior interosseous nerve. Now this artery, there is a arteria profunda brachii or profunda brachii artery, we can find within the spinal groove. It gives so many branches, one branch to the, actually these are called the muscular branch. Why this artery is passing through this muscle? Because it will supply the muscles when it is passing through the muscles. So one is, it will supply to the deltoid muscle, the deltoid branch. One will enter into the nutrient foramen, which is called nutrient branch. One to the lateral and medial head of the muscle, and ultimately it divides into radial collateral and posterior collateral, which is called the medial collateral.